Now let us discuss about the vagus nerve. Vagus nerve or the 10th cranial nerve. As we are seeing, this is the axial MR image SFP sequence, and this is nothing but the medulla, and this is the cerebellum. On axial section you are able to see the anatomy very well, and here this line, this hypointense line, this is nothing but the vagus nerve shown by this arrow. So we are able to see that they are in from the lateral part of the medulla going into the cerebellomedullary cisternal spaces. So vagus nerve is usually behind the glossopharyngeal nerve, and they also enter the jugular fossa, and in the jugular fossa the anterior to vagus nerve is the glossopharyngeal nerve, and posterior to vagus nerve is the spinal accessory or the 11th cranial nerve, and finally they are coming out of this jugular fossa through the jugular foramen. This vagus nerve is also a very important part of the carotid sheath. Behind and in between, they are between the internal carotid artery and internal jugular vein. So to see the anatomy of the vagus nerve, because it is very closely related to the glossopharyngeal nerve and spinal accessory nerve as well, we need to see the cisternal part of this vagus nerve. If there is any pathology present over this cisternal segment, we can able to visualize it here, and is the pathology is abutting the nerve or creating any mass effect over the nerve, we can even able to justify our symptoms of the patient. Moving further on to the next slide, now we will be discussing about the spinal accessory nerve, which is our 11th nerve. Spinal accessory nerve, as the name itself suggests, it has two rootlets. One rootlet is the spinal rootlet or the cervical spinal rootlet, because it is consisted of the cervical segment. The other segment are the cranial segment. These cranial segment arise from the lateral medulla and going into the cerebellomedullary system, while this cervical segment or the spinal segment, this is nothing but the cervicomedullary junction. These are nothing but the spinal segment of the spinal accessory nerves. Here also spinal segment of the spinal accessory nerve. This is an axial section SSFP-MR image, and this is the coronal section SSP-MR images. We are able to see these segments. Now these spinal segments, they are moving upward to the foramen magnum, and from the foramen magnum they come and join this cranial segment of the spinal accessory nerve, and finally with the help of jugular foramen they enter behind the vagus nerve, and glossopharyngeal nerve comes out from the jugular foramen. So we can see this spinal accessory nerve on the axial section here, but these are the spinal segments of the spinal accessory nerve, and we are able to see on the coronal section how they are moving upwards through the foramen magnum, finally to meet these cranial segment to reach into the jugular foramen and to come out, to reach into the jugular fossa and finally come out of the jugular foramen. So last but not the least is our 12th cranial nerve, which is also the hypoglossal nerve. This is nothing but a coronal oblique SSFP-MR image sequence. Here we are able to see the nerve rootlets of the hypoglossal nerve or 10th cranial nerve, and these nerve rootlets are converging onto the hypoglossal canal. And behind the nerve rootlet we are able to see the vertebral artery which is present over here. So we know that some arteries are very in close approximation with these nerves. So whenever they are pulsating, they can create neuralgia. That's why it's very important to see the nerve relation with the arteries as well. So hypoglossal nerve is not only related to the vertebral artery but also related to pica as well, which we will see in the next slide. So we should know, till now we should know that hypoglossal nerves have various nerve rootlets. They are finally converging onto the hypoglossal canal. So this is an axial section 0.8 mm thick. SSFP-MR image, we are able to see the cerebellum here, and this is our hypoglossal nerve going into the hypoglossal canal, and these are the two vertebral arteries, and behind them is the pica. So this relation of the arteries and the nerves is very important here, because vertebral arteries are very close proximation to this hypoglossal nerve. So till now we know that these SSP sequences and their cisternal segments of these nerves are very important, and they can provide you a greater detail, provide you a greater information about the relationship of the nerves and to their pathological processes. Thank you so much.